My name's Tom Eisele. I'm an associate professor here in the department. I've been here since 2004. I'm a malaria epidemiologist. My area of research really focuses on population-based epidemiology. I did my doctoral research with the CDC in Western Kenya, investigating the effect of insecticide-treated nets on all-cause child mortality. And that's really driven what it is that I do and the group that I work with here on malaria in the department. I teach two courses. One's a household sampling course aimed at doing household surveys in developing countries. And then I also co-teach a malaria prevention and control course. Well, I was a Peace Corps volunteer in Gabon, 95 to 97. And while there, I mean, it was an eye-opener, but I also saw firsthand the effect of malaria on friends, on people I knew and worked with there. Especially kids. After that, I came and I went and did a MPH and then a PhD, both primarily focused on epidemiology. My PhD focused on malaria, mostly just because it's always been an interest of mine since that time. My area of research focuses on population level epidemiology, so looking at the distribution of malaria and the risk factors associated with both malaria parasite infections as well as disease. A focus of ours that we have in the department and is monitoring evaluation. So a big piece of what we do for malaria research is looking at the effect of interventions on preventing malaria morbidity and mortality. So I'm the director of the evaluation and measurement concentration here in the department. So I work closely with other faculty members. There's about 4 or 5 of us here. We have what I would consider to be a malaria group, and we're all focused on different aspects of malaria research at the population level. We focus a lot on looking at intervention effectiveness. So we'll do, one of the things that I'm really interested in is looking at the translation of efficacy into effectiveness. So for instance, insecticide-treated nets under trial conditions have a certain efficacy, but under program conditions, what is that effectiveness meaning? How does it actually operate on the ground? And so that's a big piece of what we do and what I do here, which requires either analysis of program level data or survey data, or sometimes doing meta-analyses of intervention effectiveness trials. You really need to focus on getting a particular skill set, because a lot of things you can learn from reading books, but there's a lot of courses that really teach good skills. So what I recommend is actually to go look at job descriptions and try to pick out what type of job that you can see yourself when you graduate with an MPH from the school, and then look and see what skills they want, and then actually match up courses that meet those skills. And that's a great way of sort of honing in on what it is that you want to get out of your MPH.